In today's session, we're going to explore the critical intersections of transportation, climate change, and health through an environmental justice lens. And to do that work, we are really honored to have with us Selika Josiah Talbott. She is a distinguished transportation mobility advocate, attorney, author, and executive. She's made significant contributions to transportation sector and has held prominent positions such as the Vice President of the Los Angeles Transportation Commission and the Senior Advisor at United States Department of Transportation, FMCSA, and she can explain what that is to you. She is also recognized for her work as an author of the Sammie and Sally book series, which aims to inspire and educate young readers about transportation and mobility. She will also talk about solutions for creating sustainable, inclusive transportation systems that really promote health equity and climate resilience. Rather than spend any additional time talking about her impressive work, we will put her a link to her bio in the chat and then allow her to begin. Just briefly, the general format for today is a 40-minute presentation followed by a question and answer period. We ask that you put your comments or questions or even recommended resources into the chat at any time during the presentation, and we will get to as many of the questions as we can. Please keep yourself muted so that we are not interrupted by any background noise. And Selika, you have the floor now. Thank you so much for joining us.
Thank you very much, and I appreciate that introduction. I want to say a special thank you to Dr. Curry, Dr. Johnson, Dr. Williams, Dr. Glover, and Clarissa Payton for making today possible, and to all the fellows. I hope that you enjoy this conversation that we're going to have about a topic that I am exceedingly passionate about, which is transportation mobility. You know, it is something that I didn't expect to be a pathway or passion in my life, but the road traveled sometimes is windy and unusual. I want to give you a little bit of background about myself so that you understand where I'm coming from, because I think that's important when we have conversations about mobility and transportation. I went to college as a biomedical engineering major. Thought I was going to save the world with my new inventions. And at the very beginning of my second year, the great James Baldwin came to campus and met with students and had a speech. And afterwards, students rushed to him to talk to him. And I shared that I had been part of a protest concerning apartheid in South Africa. And we had no Instagram or X back then. So we had chained ourselves to the president's desk. We were on the news, and I'm telling him this story. And James Baldwin turns to me and says, young lady, what's your major? And I said, really proudly, I'm a biomedical engineering major. And he said, he took a pause and said, you sound like an advocate. And that sentence changed my life. I switched my major, went to law school, and worked for almost 20 years in advocacy as an attorney representing corporations. Very often the transportation OEMs, the manufacturers of large motor vehicle companies, both producing in the United States and in foreign countries. And, as life would happen, somebody else came along and said, hey, Selika, we want you to run for office. Okay, I can try anything once. I ran for office, and I lost by 250 votes. And I often include this when I talk about my path, because it was sort of in this failure that I came to the space that I am now. On the night of election, when the loss was recorded, I got a phone call from the convention floor, and the governor-elect asked me to join his administration. He said, I'd seen some of the stuff you were doing in community service and messaging, and I I want you to be part of my administration, particularly in the areas of transportation. And so I became the deputy administrator of the New Jersey Motor Vehicle Commission, which is a long way of saying I was the chief operating officer of the agency. I had 1,800 employees, a $200 million budget, and the breadth of everything that you could think of motor vehicle and truck and bus related. All school bus inspections. FMCSA is Federal Motor Carrier Safety Administration, in charge of the movement of large trucks and motor coach buses. I had all dealerships. I had all roadway violations and fines, written tests, road tests, and policy around motor vehicle movement and transportation in the state. And I did that job for about 5.5 years, bringing in roughly $1.4 billion a year for the state each of those years. And we removed red tape and tried new policies and tried to make the agency better for others. And I came to understand that there was this thing called autonomous vehicles, probably within the first 2 or 3 weeks of joining the agency. Professor Kornhauser from Princeton University came to me in my official capacity and said, we want to do a proving ground. We want to have autonomous vehicles in New Jersey. He explained the technology and how it could benefit people. And I took that advice to the governor, who said roundly, absolutely not. We will not have autonomous vehicles testing on our roadways in New Jersey. This was in 2010. So I began to study more and research. I created an advisory committee that's still standing in the state today, but realized I wasn't moving any further. I'd sort of reached the pinnacle of what I could do in that position and left and went to Washington, D.C., and as Dr. Curry indicated, became the head of enforcement for all large truck and bus movement in the United States and all its territories, and then subsequently the senior advisor to the agency. And in that space, I again wanted to see, what can we do with autonomous vehicles? How do we autonomously move goods with freight? How do we autonomously move people in buses and shuttles? And when I left the administration, I then went into academia and became the director of Environmental Justice Fellowship at UC Davis, and started teaching transportation technology and the future of mobility at USC, along with lots of other things. What I can tell you, and we'll explore this today in my remarks about transportation sustainability and healthcare, is we have to create a more inclusive and sustainable space for people to move. So my work today focuses on the intersection between transportation systems and their connections to the necessities of life, food, community, work, education, where we live, and importantly for this group, healthcare. We often think of transportation as taking us from just one space to the next. But based on my personal life experiences and research, I know that it's so much more than that. I'm a first gen. My parents used to say all the time, if you get a good education, they can't take it away from you and you can do anything you want in life. And I also know that's not true. Without transportation, without mobility, what do we do with that education? So I penned and now have trademarked the phrase, transportation is mobility and mobility is freedom. Mobility meaning the movement of goods, people, and information. I think that's a significant point. Movement is critical as it provides a connection to all of the things in life that we need in order to not just survive, right, but perhaps to thrive, to live in a modicum of quality. Either we go to goods and services or goods and services come to us. And through mobility, we gain access to jobs and preferably healthy food, education, community, and notably for you all, of course, healthcare. So transportation is necessary for life. It's providing connection. I don't just want to be seen when I have some acute or critical healthcare need, but in regular care, routine maintenance, regular checkups, especially if I have any ongoing disease or condition. And it's through mobility of information that I may have the opportunity to contact my doctor through a telephone call or an email to a site and leave a message or have a message be received by me. Mobility is a lifeline. It connects people to all critical resources. But truthfully, many traditional transportation systems have created and perpetuated barriers that negatively affect the well-being of marginalized communities. My goal in our conversation is sort of to unpack this complex relationship between transportation and healthcare and how we can lead us to more equitable access and better health outcomes for people, and perhaps share with you some of my thoughts on strategies for, again, not just even health equity, but sustainable future. We have to plan for a change. We can't keep doing what we're doing. So perhaps you're advocating for improved transit options, promoting active transportation corridors like spaces to walk or cycle. Maybe you're supporting policies that prioritize vulnerable communities. And we have to keep in mind, it's not just an urban center, it's urban, suburban, and rural communities that are impacted. There are things like drones and robot delivery and autonomous vehicles, broadband and educational opportunities. All of those things have impact on our health outcomes. Importantly, we connect the notion of, or should connect the notion of sustainability to that intersection, that meeting of transportation and healthcare. And we can start to see how a sustainable life, how a quality transportation provides healthier and longer living. I explained in my earlier background that for decades I'd been in professional positions making determinations about mobility transportation. I'll be honest, I hadn't given enough thought to the lived experiences of those in different ecosystems than myself. It was frankly through my time in Washington, D.C., and through the Sustainability and Environmental Justice Fellowship at UC Davis that I began to see, when we were exploring the breadth of transit harms, that some of these issues that come to mind from a health standpoint in this intersection of transportation and mobility, I was frankly scared about what we had done as a nation up until this point. When we think about our young people going to school and how in some communities it is evident that there are insufficiencies in terms of affordable mobility, and we see a theme that runs through every community in America, whether rural, suburban, or urban, in terms of how children move in society. I'll give you some examples of some issues that became apparent, especially through the Environmental Justice Fellowship. In America, every 5 days, someone dies in a rail-related incident. Every 5 days, particularly in rural and in tribal communities. People are exposed, these residents, to air pollution, spills from derailment, respiratory hazards, chemical exposure from leaking cars and pesticides. These are vulnerable communities, and they are disproportionately impacted living near freight operations. As a result, there's a substantial increase in emergency room visits in these communities from rail-related harms. But it's not the only place. I don't know how many of you have had any time spent in Florida, but the Bright Line in Florida, which connects Orlando all the way down to Miami, sees a death on that rail line every 13 days. I just want to pause for a second and let that sink in. Every 13 days on just one rail line in America, there is a death. And make no mistake, we are not confused as to why those deaths are happening there. They're inadequate crossings. They have quiet zones because some communities don't want to hear the horns. Congestion, sadly, people with mental health issues who are taking their lives. There's a lack of information for most of that community, a lack of concern. And it is a private transportation system that is failing the communities throughout Florida. Education would go a long way. Lobbying officials to do away with these quiet zones, mandating more gate arms and additional fencing, treating those with mental health issues, they'd go a long way to batting down this statistic as being the deadliest passenger railway per mile in the United States. And when we turn from rail and look at movement by vehicle, in the United States, 3 to 4 children die every single day in a vehicle-related crash. Hundreds are injured, but 3 to 4 die every day, and Black and brown children die at 4 times the rate of others. This is something that we should be working to improve, not with platitudes or cute phrases, but thinking about how we address transportation as a whole so that we can prevent these harms from happening to our residents, not only in the United States, but these things are happening across the world. We have an over-reliance on fossil fuel-powered vehicles. They cause damages for our environment, hazards for our youngest children and most vulnerable in our society. We have factors that surround high vehicle emissions, unsafe driving practices, inadequate road structure. So what is the role of transportation in public health? I believe that a well-structured transportation system bridges gaps and ensures that everyone has an opportunity to reach essential services without undue burden. Imagine a world, and some of you may be living this now, where access to a doctor is a 2-hour bus ride away, or the nearest grocery store with fresh produce requires multiple transfers on unreliable public transportation. This is a reality for thousands of people, tens of thousands of people in America every day. And it is frankly a prime example of how transportation can either empower or inhibit the health of a community. Take, for example, a single mom who lives in an underserved neighborhood. Her health and that of her children is directly linked to whether or not she has easy access to medical facilities or healthy food options. And when transportation is poor, communities face higher risks of health challenges simply because accessing care becomes, frankly, a debilitating chore. When we talk about transportation health, pollution and safety are also at the forefront. Traffic congestion contributes significantly to urban air pollution, which in turn exacerbates respiratory issues. And studies show that marginalized communities often live closer to highways and busy roads, which expose them to greater levels of harmful pollutants and increase the incidence of respiratory and cardiovascular diseases. There are approximately 26 million school-aged children in America who ride a school bus. Most of those are diesel-powered. It was the choice because at the time they considered it more economic, but research certainly has shown that there's a direct correlation between diesel exhaust, air pollution, and ill health outcomes for children. The harm is extensive. It's well documented that these kids who will suffer poor air quality will be linked to neurological and developmental deficits. It affects these kids' long-term health and academic performance. A sustainable, healthier option for students would be to rid our school systems of these diesel fuel buses and opt for electric buses. One of the ways to do that is to perhaps run for school board seats as medical professionals and infuse the contracting with health-based decision making. Green spaces. We have these sprawling urban transport networks that mean there are fewer opportunities for people to exercise and relax. Of course, we know that impacts you from a mental health and physical health standpoint alike. So we want to prioritize more green space, more inclusive transportation options, community-centered planning, promote the use of electric vehicles, expand public transportation. And of course, the solution also lies in infrastructure, safe pedestrian pathways, dedicated bike lanes, effective traffic calming measures. All of those can transform urban settings. In cities around the world, they closed some streets off around schools to allow families to cycle and walk, which dramatically improves safety and well-being. There are education and policy that can play a critical role in advocating for and implementing strict traffic laws. Educate riders on safe practices, and healthcare professionals can play a big role here. You can inform policy and community initiatives. You can show the real cost of vehicle crashes on children's health. Healthcare systems need to be robust and efficient. There's the actual providing of the healthcare. Telemedicine and emergency services are vital when we need urgent and appropriate care for children. Training first responders specifically for pediatric emergencies can make the difference between life and death. And ultimately, as we all know, the responsibility to protect children lies with society as a whole. Educators, policymakers, healthcare providers uniting to create safer transportation systems. It's more than just preventing harm. It's about envisioning a world where children can thrive, breathe clean air, and move about without injury. We can adopt some of these new policies that have a positive impact. We can add crosswalks and traffic lights and educate kids about safety. We can ensure that there's better lighting in communities, play zones for children so they're not running in the roadway, installing not just seat belts and car seats in cars, but educating bus drivers and conductors on children's safety, making sure the buses in your neighborhood have the stop arms to prevent people who are trying to go around the bus illegally, which causes harm to children getting on and off the bus. Workshops in communities work. You can educate children and their parents on transportation safety. And of course, technology. There are wearable apps we have nowadays that alert drivers when children are nearby, especially in school zones. These initiatives show that there's a mix of policy, infrastructure changes, education, and community involvement that can significantly impact a better outcome for children in urban transportation settings. It's not all gloom and doom, right? We are infusing new technology into transportation. We have electric bikes and scooters, and there's a resurgence of one-wheelers. And we know that with those things comes an increase in emergency room visits. It just means that more education is necessary. So when doctors are seeing patients, I know it's another thing, but to add to the list, not just are you wearing your seatbelt or is there a car seat in the car? Are you wearing your helmet? Are there safe places for you to cross when you're going to and from school? Do you have an electric school bus that you take? Gathering that critical data can help inform how we address future education around transportation, healthcare, and sustainability. I've been calling out a lot of wrongs, but I'm not going to do it without opportunity to start also talking about some of these solutions. We don't have to poke people in their eye and say climate change. We know it's a real thing, but some people, they can't get their heads around that word and they are very myopic and only think about themselves. So we can talk about improvement in opportunities in transportation and healthcare in ways that aren't off-putting to those who are afraid of certain words. We can talk about a smelly bus if they don't want to talk about hazards of chemicals and pesticides and pollutants. We're not always going to have an opportunity for big business and government to support the best interests in the community. And we're seeing issues like that more and more today with the rolling back of funding for a lot of these initiatives. My suggestion is to harken back to the olden times where we had boycotts and sit-ins and marches, but some of the most impactful work came from community-based organizations, building power from the ground up, organizing educational campaigns, health initiatives, clinics, serving those who are underserved, volunteering your time and your resources to assist people in need. Urban planning in the United States is probably one of the most important jobs we could possibly have, and yet there is no requirement that people live in the community for which they're planning. Law enforcement officers in lots of communities have to live in the community where they are based, because we understand that when you police your neighborhood, you have a greater understanding of the issues in that neighborhood. And people who live there understand that the police are to be problem solvers and that they should be looking out for their neighbors rather than instigators of arrests. I speak at conferences globally. And more often than not, those people who are responsible for public transportation, they have no clue as to how the people that they are servicing are impacted by the very transportation systems that they oversee. That's because most of them get in a car by themselves and drive into and from their office. I know because I was one of them at one point. But we have to get to the point where urban planners and people who are responsible for these major transit systems are writing them every single day so they can see where the improvements need to come and where they are failing the communities that they service. Perhaps one of you wants to consider running for school board. You can impact your community best at the local level. You can advocate for policies that require mobility education as early as possible, so kids and parents know how they should move through society, and things like the stop sign applies to you too, even when you're not in a car. You can advocate for a bus that's not smelly. For rail-related crashes, are we having a day? Are we writing letters? Are we designating action from a medical healthcare standpoint? We don't want to just eradicate the result of poor mobility options, but eradicate the poor mobility options themselves so we don't have the harm from them. We need better equipment so there's no leakage. We need better infrastructure, less toxicity being moved through people's communities, better education around the healthcare outcomes. For the past 15 years, I've had the privilege of working around autonomous vehicles and in the autonomous movement space. I'll tell you what, in rural communities, if autonomy was taking families to and from their doctors and their healthcare clinics so that they were seen in routine and regular care, not just in acute crisis, it would cost society less and allow people to live healthier longer. I often talk about an example of how mobility can impact us. And I use this signature story all the time. I'm going to preface this by saying it's about a mother-in-law, and I love my mother-in-law, at least this one. The first one, not so much. But this one I really love. And so those of you who may have a tricky situation going on with your mother-in-law, you might appreciate this. Your mother-in-law is coming to visit, and you know she's kind of an opinionated person. So you make sure before she gets there, you go to the store, you get a new duvet cover for the bedroom. You might get new towels for the bathroom that she's going to use, and maybe even a little carpet so when she steps out of the bed in the morning, her feet feel all nice and warm and cozy. And mother-in-law comes, she spends time with her son, her daughter-in-law, the grandchildren. She's there for a few days and she has a great time and she leaves. We could choose that option, but I have a different version that I like better. Mother-in-law's coming and we want to prepare for her. We start to look around the space that we live in. And this 36-inch television, we've had it for forever. So maybe we'll move up to a 55 or a 70-inch TV and we'll get that. And that couch that we sit on every night, it's in really bad shape. I think we need to get a new couch and maybe we even get one with a reclining feature. So mother-in-law comes and she sits in that reclining couch. She's going to feel so good. And we don't normally eat around the dining table, but we will when she's here, and those chairs really need to be reupholstered. So we decide to go ahead with this new plan. So instead of focusing on where she's just going to sleep, we focus on the community space where we will all be. So mother-in-law comes, she has a great time with her son and daughter-in-law and the grandchildren, and then she leaves. But when she leaves, the space has been improved by her very presence alone. It's not that we don't want to show up for her in that room, but we have used her presence as a catalyst to improve the space in general. So what does this have to do with healthcare? The United States is going to host the World Cup in 2026. And then after that, Los Angeles will have the Super Bowl. And then after that, Los Angeles will also have the Olympics. We can use this as a catalyst. We can service people who are visiting us and provide them healthcare in sustainable spaces, and that when they are gone, we can improve community and life for the people that actually live here. And then we can repeat that, rinse and repeat, in city after city across the United States. Establish temporary medical facilities at sites, and then see how you can transform them into permanent community clinics that can be used post-event. We have so many healthcare apps. Developing one that has real-time information about nearby healthcare facilities. After the event, that same app can be used to service residents in your community and perhaps add some broadband in with it as well. We could create upgrades to our public transit system. Hoot if we just expanded some of these bus lines instead of cutting them. We're going to do it for the visitors. Why not make these routes permanent to facilitate better mobility for residents in our communities? Wi-Fi and broadband is an issue in so many communities, and it is a barrier to healthcare for many. We can work with broadband for good. We can set up information kiosks to assist visitors and then continue to support residents of our communities long after these sporting events are over. We have apps for translation support systems for those who speak different languages. That's what we will do when we have people coming from across the world. We have communities across America where they speak multiple languages. Let's continue to use these services afterwards to support diverse communities in the long run. These initiatives, they don't always just help to manage the influx of visitors, but they truthfully can lay a foundation to improve the quality of life for residents. They're collaborative efforts between government bodies, businesses, local communities, healthcare, and they are solutions that can be impactful to communities at large. Policy and advocacy play a role in promoting equitable access to transportation. We could implement reduced fare programs, open up transit options for low-income individuals, zoning reforms. But policy changes, they don't exist in a vacuum. You all have influential voices. By advocating for transportation policies that address social determinants of health, you can drive systemic change. Physician-led movements to date have successfully championed for safer road designs, reduced emissions, improved access to public transit. Imagine the collective impact if more healthcare providers engage in that kind of advocacy. Sustainable transportation is fundamentally about ensuring that all communities, regardless of your socioeconomic status, can thrive. We want to foster environments where healthy choices are the default and not a dream. Equitable transit policies are powerful. We can dismantle barriers to access. I am going to encourage you. Hopefully, the words that I am saying are like that one sentence from James Baldwin to me, to engage in policy advocacy and community projects that align with these goals. Consider becoming a voice for change. Support your communities. Attend city planning meetings. Collaborate with local planning officials and use your expertise to influence decision makers. We need healthcare professionals, urban planners, policymakers, and community leaders to work together to form interdisciplinary teams. Through that, we can innovate and implement solutions that address these complex challenges that sit at the intersection of transportation, climate change, sustainability, and healthcare. And we can make lasting improvements for all communities. Your role in this is invaluable. You have the power to make a difference. I urge each and every one of you to look at the full landscape of new technology as it begins to infuse in our communities. We have drones, we have heliports, we have robot delivery of medicine, we have autonomous vehicles, we're moving towards electrification and other zero carbon forms of powering our vehicles. But none of it means anything if we don't champion the voice of moving towards technology that assists us all. Too often we see communities where we are pushing urban against rural. Urban communities almost seem to get it all, but yet they have last mile issues that make it feel like it's 20 miles. Rural communities have such a far distance to go to get the resources that they need just to live on a daily basis. It's through our collaboration and our coming together that we can begin to address these issues, but to support each other, whether we are rural, whether we're suburban, whether we live on tribal land or we live in a big city. There are, of course, systems and institutions and barriers that for years have caused us to have inferior access to healthcare. When Rosa Parks chose to not sit in the back of the bus, I know most people think she just got up one day, right, and said, I'm tired of walking to the back of the bus. But the truth was there was a systemic issue, not just in her not being able to sit in the front of the bus, but the system back then required that you pay at the front, then step off the bus and walk to the back, and then enter the bus and go sit in the back. Prior to that fateful day that started the boycott in Montgomery, Rosa Parks had an issue with that same bus driver. Prior to that, she had paid, gotten off the bus again, and walked to the back, and the bus driver drove away, leaving her there, her money taken, and no transportation provided. This is emblematic of what we've done today, but we are able to stand together Our boycott is literally our voices. Our boycott is our action. Our boycott is our advocacy to say, you're not going to leave us behind any longer. We want a new day. We want better outcomes. We know that we are entitled to it and we deserve it. And we want to not just survive, we want to thrive. I leave you with my favorite phrase: transportation is mobility, and mobility is freedom. Thank you.
You, Selika. That was so informative and such a valuable presentation. And the framing of transportation and mobility and freedom, I think that will stick with us. So thank you so much for that. We want to see what questions that we have. Our first question: how do current transportation policies and infrastructure contribute to health disparities in our underserved communities?
Well, I mean, it's almost too much to mention in a short order. Sometimes it's as simple as where the exits and entrances are on a highway to a community. Sometimes it's where the rail line passes through a community, almost cutting you off. And so one side is the haves and one side is the have-nots. We have communities where there's no grocery store, and the travel to get to that grocery store, even though in actual miles may not be very, very far apart, it's several buses or an excessive amount of time on a bus. I took a trip recently and I was thinking of taking public transit in from the airport to my location. It would have been 29 minutes. It was late at night if I chose to take a ride share, but it would have been almost 3 hours if I took public transit. Those systems then deny people who are relying on public transportation the fullness of life. I can't get a job if it takes me 2.5 hours each way to get there and still take care of my family, which means then we're suffering in terms of not bringing in enough money and maybe not having access to healthcare and not having access to healthy food. And then it exacerbates and that cycle repeats over and over again.
Thank you. That's very helpful to think about. Most of the time as med students and as physicians, we don't think about land use or zoning or transportation as being a health issue. So this has been extremely helpful. We do have another question. What are the most impactful policy changes or funding strategies that could advance both transportation justice and health equity in the next 5 to 10 years? That's a broad question, I know, but just give us your thoughts in terms of what your expertise tells us.
We need access to better public transit options. Relying on that personal vehicle to take you to and from is not where government should be putting their money. But what has happened, and COVID, COVID has exacerbated so many things. A lot of these public bus lines or train lines have reduced their services. They said, well, we don't have enough people riding these, or we don't have enough drivers. So if you think coupling autonomy, so maybe there's an autonomous driver, with expanded routes, means that you have greater option to mobility and then greater access to the things that will make you healthier and keep you living a better life. That all requires government funding and, frankly, government buy-in, and they're not going to do it themselves. So somebody has to sound the alarm. And if the alarm comes from the medical community, if you are speaking about this in as many places as you can, it'll be hard to deny it in the long term.
Okay, our next question really picks up on your thought about the autonomous driving. And so the question's from Dr. Holder: with the rapid improvement in AI, how close are we to fully expanding autonomous driving vehicles in cities and in rural areas?
I'm part of the autonomous vehicle industry, and we've been saying for decades now, it's coming, it's coming, it's coming. But really, when you see deployments, um, not just in San Francisco and Los Angeles, but in Phoenix and Dallas, in Orlando, in Washington, D.C., in Baltimore, in Atlanta, you see it is a ripple effect. I didn't say this before, but it's usually my public service announcement for the Tesla drivers who are on this call. Um, Autonomy is level 0 through 5, 0 being a regular car with no autonomy in it, and the highest level is 5, and we consider 5 almost not attainable because 5 means anywhere, anytime, under any condition. And as you know, there are times when a vehicle shouldn't be on a roadway just because of the tires and the snow or monsoon or whatever the physical conditions are in that environment. Level 4 is an autonomous vehicle. That means eyes off, mind off, you're not in control, it doesn't even need a steering wheel, it moves on its own. What we the misnomer of FSD says full self-drive. That does not exist. You have to have your mind on that task of driving, and you have to be engaged in the task of driving if you're in a Tesla. And I think recent court cases have certainly borne out what we know in the industry. So it's coming, definitely coming.
Thank you. We have another question from Dr. Callens. What other service opportunities should we consider besides school board as a way of making some local changes?
Yeah, I mean, being part of a fellowship alone, to me is an important step. It's outside of the everyday thing. You're taking that extra mile, and the work that you're doing here, the connections that you will make with each other will be able to ripple effect. You'll see what one is doing in one community and you'll want to replicate it in your community, or you'll cross community, try a pilot, or introduce your facilities and institutions to new ways of doing things. Um, I think as many spaces as you can be. School board is a big thing. I will not deny it's a lot of work, but there are other ways in your community to be involved. Workshops, um, seminars, going places and speaking about what you are an authority on so that people can't deny it. Many of you volunteer your time. And so even in the times that you volunteer and you go into a community and you're Doctors Without Borders and assist in those communities, it's a place to also talk about mobility. One of the things, though, I also want to stress is, when people bring, especially their children to a doctor, and there's that checklist of questions that you're asking the parents about how they move with their children, I really am strongly encouraging that we begin a mobility conversation much earlier with community. Before we do anything else, we move, right? We either move in our parents' arms or in that stroller, and then we begin to put our two little legs on those streets. But nobody tells you how to move. Cross at the green and not in between is not sufficient to keep us safe as we move throughout community. And we need, especially in underserved communities, to understand the benefits of new technology and then insist that they be part of our communities. When people are looking at investments for venture capital and private equity, start to look at how the benefits of new technology will impact healthcare in your communities. And perhaps those are also ways in which you can get involved.
We have time for maybe 2 more questions. I want to follow up on that response you just shared. This was a comment from Sylvia Starlack that said, support your local Safe Routes to School program. The idea of prescribing walking and biking to school for patients. Have you had any connection with any of that work?
We do. In Los Angeles, we have sort of our high priority corridors where we promote the safe walking to school. And, it is critically important in big cities. And so we seem to only focus on them. But I want to remind people, especially for those of you who are in rural communities, it is almost less safe there than it is in a big city. The reason we have, these rail deaths every 5 days in America is because very often sort of the children crossing from one side of the track to the other to attend school means they're, running underneath moving train lines. This all requires a significant amount of education, but we got to be careful about platitudes because we have something like Road to Zero. Who believes you're going to have 0 deaths on the roadway? Like nobody actually believes that. So it sort of stunts the effort and the movement. Safer roads make sense, and it's something that we can certainly all get behind.
Thank you. I think probably our last question. This is on the anniversary of Hurricane Katrina. Could you give an example of your career success that address the inequity of the intersection of mobility and the weather disaster preparedness?
Yeah, I mean, if I could have spoken more, there are like 95 other topics that I could have talked about. Weather is significant. Um, Not just whether we alert people in time that there's a catastrophe, but even when we alert you, if you don't have the means of mobility, and this is really a large function of what happened during Katrina, you're stuck. And then what healthcare is available to you under those circumstances? We see it in disaster after disaster, whether there's a hurricane or an earthquake, a tropical storm. I lived in New Jersey during what we call Superstorm Sandy and was without power for 3 weeks. People really suffered in that time. They were in spaces where, again, they had no access to communicate, no telephone lines. Fortunately, it wasn't the dead of winter, but they didn't have access to food. They didn't have energy, no power in their homes, and people died as a result. So part of it is in a resiliency, that's what we call in urban planning, right? That you prepare for both shocks and stressors in society and begin to have programs and planning for what happens in disaster times like an earthquake or a hurricane, and how we move people much more efficiently so they're not staying in a space that will obviously be unsafe for them for long periods of time.
We have one more question. Because I want to give them an opportunity to ask it. So the question,
Absolutely.
Working at the intersection of climate, health, and labor, trying to convince employers that they should care about climate risks and workforce health. How would you recommend talking to transportation employees about these subjects of climate, health, and equity?
Listen, it's usually a dollars and cents thing. Being more sustainable is generally less expensive. Having good transportation policies and solutions keeps the business running efficiently and effectively. And there are ways that you can model what it costs to do something one way and what it costs to do something another way, which is why I often use the example if you're in a rural community and grandma has to go to the doctor and we got one vehicle on the farm, that vehicle is supporting the work of the farm. We can't take grandma to and from the doctor once a month for her regular and routine checkups. So only when grandma is, in acute crisis, now we throw her in the truck and we drive the 50 miles to healthcare. But if community had a roving autonomous vehicle that picked a shuttle that picked people up in community and took you once a month to healthcare and brought you back, now it's cheaper on society. Even if you are on public assistance, it becomes a less expensive healthcare outcome to provide mobility for people. So insurance companies should start to look at this. I certainly advise it, that they find ways to make it a better outcome for them financially. And of course, we know from a humanity standpoint that it is the right thing to do.
Thank you so much. I know that this discussion could go on a lot longer, but we do need to wrap up the session. I would like to thank our speaker again for such an informative talk, and also to all of our participants for joining us for this series. As a reminder, these webinars are held on the second Friday of each month at this same time. Our next webinar will be September the 12th. We will cover the position voice, environmental justice and climate justice, community organizing, and resilience. Before you leave, we will ask you to take a moment to complete the webinar survey if you haven't done so already. The link is in the chat. We are just about at time. So again, thank you all for joining us. And we do hope that you will join us again. This concludes our session for today. Thank you so much. Have a great day.
Thank you for having me.